Hi everyone. After discussing the sphenoid bone today, we discuss the occipital bone, an unpaired flat bone that makes up the neurocranium. The occipital bone forms the posterior aspect of the skull and the posterior floor of the cranial cavity. It articulates with the temporal, sphenoid, parietals, and the uppermost vertebra, the atlas. The occipital bone articulates with the sphenoid at the spheno-occipital suture, with the temporal bone at the occipitomastoid suture and the petro-occipital or petroclival suture, and with the parietal bone at the lambdoid suture. The basilar part of the occipital bone and the sphenoid body articulate at the spheno-occipital synchondrosis. In adults, the division between the two bones is not appreciable because physiological closure of the spheno-occipital synchondrosis is well underway by the age of 15 years and complete by 17 years. The petro-occipital or petroclival fissures are the paired articulations between the lateral surface of the basilar part of the occipital bone and the posterior and medial surfaces of the petrous apex of the temporal bones. The occipitomastoid suture is the suture between the occipital bone and the mastoid portion of the temporal bone. The occipital bone is the most posterior cranial bone. It is the only bone that relations with all intracranial membranes. It consists of 3 parts, including the basilar, squamous, condylar parts, all of which have outer and inner parts. The main feature of basion is to form spheno-occipital synchondrosis with the sphenoid body. Synchondroses are cartilaginous unions between bone, composed of hyaline cartilage. The basion has an inner, smooth, concave face, the support point of the pons and midbrain, called the clivus, that is also the point of articulation between sphenoid and occipital bone. Lateral to the clivus are the condylar masses that arise from the inner face of the basion. The posterior face of the basion has a protuberance called the pharyngeal tubercle, point of origin of the superior pharyngeal constrictor muscle and the pharyngobasilar fascia. The latter starts from the pharyngeal tubercle of the occipital bone and merges with the buccopharyngeal or visceralis fascia. The visceralis fascia covers the pharyngeal muscles and other visceral structures of the neck, pharynx, esophagus, larynx, and thyroid. The group of muscles called the pharyngeal muscles, which consist of the outer circular layer and the inner longitudinal layer, forms the lumen of the pharynx. The outer circular layer consists of the superior, middle, and inferior pharyngeal constrictor muscles. These muscles insert posteriorly to a tendinous seam called the pharyngeal raphe. The superior pharyngeal constrictor contracts and narrow its lumen to assist with bolus transport as well as seal the nasopharynx to prevent food from going up. The middle and inferior pharyngeal constrictors contract to narrow its lumen to assist with bolus transport. On either side of the basion are 2 ridges that are the points of origin of the rectus capitis anterior muscle of the head. These are muscles that connect the occipital to C1. The contraction of these muscles causes the occipital bone to flex on C1, the muscles we use to make the gesture of yes with the head. Upon contraction, the rectus capitis anterior muscle aids in flexion of the head at the atlanto-occipital joint. As well as the rectus capitis anterior, the basilar part also provides muscular attachment of the longus capitis. The condylar part of the occipital bone forms the lateral walls of the foramen magnum. The outer face of the condylar masses have a convexity called the occipital condyle. This 2 protuberances on either side of the foramen magnum serves as an articular surface to the superior facets of the atlas. Posterior to the condyles lies a depression called the condyloid fossa into which the condylar canal passes. This canal contains emissary veins connecting the sigmoid sinus to the occipital vein and the meningeal branch of the occipital artery. At the base of the condyles on the cranial or inner side is the hypoglossal canal, where the hypoglossal nerve exits and a branch of the ascending pharyngeal artery enters. The hypoglossal nerve is mainly a somatic efferent or motor nerve to innervate the tongue musculature. The nerve also contains some sympathetic postganglionic fibers from the cervical ganglia, which innervates tongue vessels and some small glands in the oral mucosa. In the lateral part of the occipital bone, extending lateralward from the posterior half of the condyle is a quadrilateral triangular plate of bone, the jugular process, which forms the posterior part of the jugular foramen. The jugular foramen is an hiatus located between the clivus and the petrous part of the temporal bone, its extremities are related to the petro-occipital fissure and occipital-mastoid suture. From the inferior surface of the jugular process of the occipital bone to the superior surfaces of the transverse processes of the atlas originates the rectus capitis lateralis that provides lateral flexion of the occipital bone on C1. The squamous part of the inner surface provides attachment for the falx cerebri, falx cerebelli, and tentorium cerebelli. It contains a groove for the occipital sinus. To brush up on the topic, I recommend the videos on meninges and intracranial membranes. The groove for superior sagittal sinus is superiorly located to the protuberance, a midline vertical ridge called the median internal occipital crest that runs from the internal occipital protuberance to the foramen magnum. Normally, the internal occipital crest, protuberance, and groove for superior sagittal sinus are aligned in a straight line. The cruciform eminence, or cruciate eminence, divides the deeply concave internal surface into 4 fossa. The upper 2 fossa are called the cerebral fossa, are triangular and lodge the occipital lobes of the cerebrum. The lower 2 are called the cerebellar fossa. They are quadrilateral and accommodate the hemispheres of the cerebellum. The upper fossa are separated from the lower fossa by a groove for the transverse sinuses. At the point of intersection between all 4 fossa is the internal occipital protuberance. The outer squamous part contains the enion, that is the tip of the external occipital protuberance, which is mirrored by the internal occipital protuberance in 3 horizontal so-called nuchal lines. The supreme nuchal line extends laterally from the external occipital protuberance and is the site of origin of the nuchal ligament, also called the ligamentum nuchae. It's a strong fibrous tissue that extends from the spinous process of the first thoracic vertebra to the external occipital protuberance. The nuchal ligament limits forward flexion of the head and the cervical spine. It also serves as the attachment for some major muscles. The superior nuchal line runs slightly inferior. It provides origin to the trapezius, sternocleidomastoid, and splenius capitis muscles. The inferior nuchal line runs further inferiorly. It is the point of insertion of the semispinal capitis muscle. Rectus capitis posterior minor muscles arise from the posterior tubercle of the posterior arch of the atlas and insert into the occipital bone inferior to the inferior nuchal line and lateral to the midline. Rectus capitis posterior minor muscles are the only muscles that attach to the posterior arch of the atlas. Rectus capitis posterior major muscles arise from the spinous process of the axis and insert into the lateral part of the inferior nuchal line of the occipital bone and the obliquus capitis superior muscle that arises from the superior surface of transverse process of atlas and inserts between the superior and inferior nuclei. The foramen magnum functions as a passage of the central nervous system through the skull, connecting the brain with the spinal cord. On either side of the foramen magnum is an occipital condyle. These condyles form joints with the first cervical vertebra. The foramen magnum contains the medulla oblongata, meninges, spinal root of 11 cranial nerve, vertebral arteries, anterior and posterior spinal arteries, the tectorial membrane, alar ligaments, and denticulate ligaments. To summarize, from a higher and forward view, we can see the spheno-occipital synchondrosis, point of articulation between the basilar part of the occipital bone and the dorsum cello-sphenoid, the foramen magnum, the cruciform eminence that is formed by a groove for the transverse sinuses that divides the upper cerebral fossa from the lower cerebellar fossa, the internal occipital crest, the inferior arm of the cruciform eminence that gives attachment to the falx cerebelli. The internal occipital protuberance lies at the center of the cruciform eminence. The sagittal sulcus passes superiorly from the internal occipital protuberance. That is a deep endocranial groove marking the posterior extension of the sagittal sinus, a major blood drainage pathway from the brain. We can also see the lambdoid suture, point of articulation with the parietal bones. From this perspective, we can observe the clivus, a concave face, the support point of the pons, and midbrain, the hypoglossal canal that give exit to hypoglossal nerves, and again the lambdoid suture. From this superior view, we can see the occipitomastoid suture and the petro-occipital suture that are the paired articulations between the occipital bone and the temporal bones. The jugular fossa that forms the posterior half of the jugular foramen, where the sigmoid sinus and the inferior petrosal sinus drain into the internal jugular vein, and where cranial nerves glossopharyngeal, vagus, and accessory exit. From behind, the supreme nuchal line extends laterally from the external occipital protuberance, and it is the site of origin of the nuchal ligament. The superior nuchal line runs slightly inferior. It provides origin to the trapezius, sternocleidomastoid, and splenius capitis muscles. The inferior nuchal line runs further inferiorly, point of insertion of the semispinal capitis muscle. The enion, the midline bony prominence in the occipital bone from which the ligamenta milki and trapezius muscle attach. From below, we can see the occipital condyle that serves as an articular surface with the atlas. The condylar canal that contains emissary veins, connecting the sigmoid sinus to the occipital vein and the meningeal branch of the occipital artery, and finally the pharyngeal tubercle, point of origin of the superior pharyngeal constrictor muscle in the pharyngo-basilar fascia. That's all for today. I'll leave you these videos if you want to review previous topics or to continue with new ones. See you next time.